enlarge this, make it full screen. And let's take a look at this patient. This is a patient that has had multiple visits, Jim Sullivan. We went through how the colors change, how the visual acuity is carried through. When we change it in one area, it changes in the corresponding areas. If we have somebody who's current glasses, they're seeing 20/30, the acuity is automatically there and on the summary page. Let's hide that. Oh, before we had it, notice these came up when we started, when we opened the page, because that's how we closed the last patient. If we close this and we're going to refresh the page, this data will show back up again, because now that's your preference. All right. So let's look here at Jim Sullivan. He's got multiple visits. This is 12/2/2014. Here are the prior visits that are in the database. And all of a sudden, the prior exam shows up on the right. It's grayed out. These fields are disabled. They can't be changed. And there's a little clipboard feature here. When we fast forward to today's visit, the clipboard feature disappears. These are all of today's values. But let's go back a day. And let's see, this one has a change. A little bit of brow ptosis, no brow ptosis. And let's carry those values forward. And what happens when we carry them forward? The fields that were tan that have changed are now purple. Recall, if we go in and touch a field, it turns yellow. If we change that field and say 1 centimeter brow ptosis, it will turn blue. Next one's yellow. We touch it, it's yellow. We touch it, it turns yellow. But if we touch it and change the value, it turns blue. I don't know, let's say +1, poor tone. All right, fine. And we'll tab off of that. Boom. So we can select priors based on date, carry forward for subsections of the exam, or we can do it all together at once. So let's go to a different day, maybe the 19th, and let's carry it all forward. Now, the 19th, there's different values from today, and those different values have been carried forward and turned the screen to purple. Not much changed there, not much changed there. Here, a little bit changed, and the motility changed. Yep, motility changes as well. Let's say we want to carry this motility forward. By clicking on that button, everything that is present here is now moved into and displaces what's present there. So this carry forward feature. We have the quick picks area, which I showed you earlier. We have the draw feature, which is the HTML5 draw program. And we have the text feature, which you can get to from there or from here. The text feature is dependent. However you open these and close them will determine how it's opened and closed in the future. Some people always need to know central macular thickness because they're going to be injecting something, VEGF for their AMD, and they'll want that open. And other people really could care less about plastics functions, so they need that's closed. The flow is set based on what your prior experience has been. As the clinician, the next clinician is going to have their own very